Hi, I'm Dr. Bill White. I'm a general dentist that has done nothing but orthodontics for the last 45 years and did it a good many years before that, but I did other things too. Uh, I'm with the American Orthodontic Society, and I want to talk to you a little bit today about an unusual thing that happened to me several years ago, and that's I had a wonderful oral surgeon, Dr. Larry Spradley, in Hurst, Texas. Actually, he may have been over in Bedford. The towns were tied together closely, but he and his partner, Dr. Dean White, did a lot of oral surgery for me, and he transplanted an upper wisdom tooth on the right side of the mouth and on the to the lower second molar position. I had a young lady who was congenitally missing both the second and the third molar on the right side of the mouth, and she had them both up above, and it was an unusual thing. And I talked to Dr. Spradley about if it was possible to move that upper wisdom tooth bud down into the area where the lower second molar was supposed to be, and he said it's possible. And so he waited and watched it until the bud got to the size that he felt was most desirable, and then he transplanted it from the upper position down to the second molar. Just opened the spot and kind of dug a spot and put this bud in it and covered it up and sutured it. And it took about 7 years, 6 or 7 years. I'm going to show you the x-rays of this in just a moment, how it moved down into position. Excuse me, it actually grew there and then came up and went through the tissue and opposed the upper tooth. But it was several years later when it did that. Here is the young lady, just a nice little girl, no problem, but she was missing several of her teeth. I'll show you some. We'll go through her x-rays here in just a minute. Cute little gal. It was real nice, and I felt like we've got to do something here. This first cephalometric was taken in 1968, and we were still doing some regular dentistry at that time. I didn't stop doing my regular dentistry till 1970, and but that's almost 45 years ago, so it's been a long time. I don't know, I didn't get to follow up this young lady too many years later, but we'll show it to you. Now here is the Panorex that we took, and just the old type Panorex, and it shows you the position of the teeth and everything. The lower second molars here haven't erupted good, so we took these teeth out and cleared away, and these teeth, the lower second molars started coming in after I removed these. But up to here, they were blocked off. They just would not go. And you have to watch some of these. So after I took them out, it took quite a while before this came up. And nothing developed in this area. Just absolutely nothing in here. But we had a wisdom tooth started forming up in this area. And as this second molar up above came down, when I got it down to this area, I had to hold it there with some type of retention. I did something there that kept it from erupting into this spot, and he transplanted that tooth from up here. I'll show you on the x-rays just a little bit further down the line here. But anyway, this was a Panorex that we took some time after we started. Now here's 1972. I think that other one was 1971. See, so the first x-ray you saw there was 68, I believe. Now, we've removed the baby teeth, and these teeth still haven't made it up in here. This one's drifted over a little bit. We didn't put a space maintainer in there. This one drifted too, just slightly back, but not blocking this off. So this tooth finally came on up pretty much into the position. Now let me go back, and I'm going to erase this and go back, and we'll see this was 72 and this was 71. So we took that out in 71 and it didn't come in by 72. It wasn't in. Now at first in 68, well, we can't really see what was going on through this self, but the young lady didn't have those teeth. All right. On the left side of the mouth, they developed, anyway, this is a 12-year molar, I think, back there on the left side of the mouth. All right, here's 71, and that's 72, and these teeth have come up a little bit further, and here we are in 74. Now in 74, we decided to go ahead and put her in braces, and so we did, and we brought the molar on the second bicuspid on the end. We'll line it up, did over here, and actually we don't see a wisdom tooth on this side yet. So this tooth doesn't look exactly like a 12-year molar, but anyway, it'll be a tooth. It'll come in that area. Now up here we've got the 12-year molar, and here is this wisdom tooth, and that's the tooth that we're going to actually transfer down to this spot right here. And this is Dr. Larry Spradley. He's a wonderful old surgeon. I think he's retired now, but he became our Texas State president 7 years back. Been very active in dentistry and in oral surgery. All right, here's an X-ray taken in 1977, and he kind of picked out the time that he was watching this bud form and how much he didn't do it when I told him about it. He waited until the tooth got to a desirable size. And anyway, so I don't remember exactly the time, but this was 12 of 77 here when we took this picture. And he's going to remove this tooth up here and transplant and open up this area and put it down here. So I'm going to show you another view of this. Now just let's see what happens here. All right, this is 1979. He took that out, transplanted the tooth, I think in 77, something like that, and buried that bud and covered it up in here. And this is a couple of years later, 1979. So this has taken a long time to do. Now this other tooth came in, you see, and we got this all lined up good, and we're just sitting around waiting, but I've got some type of retention in there that's holding this second molar to keep it from dropping down over this. You don't want to have this tooth bumping into that, for sure it wouldn't do anything. So you got to keep it open here. So this is 1979. Now I took that and I knew it was growing and the tooth was alive and everything was going on good here. So I kept seeing the young lady, but I didn't take another picture, I don't think, until this picture right here, which is 1986. And the tooth came through the tissue and was just about to come in contact with this tooth above it. But the tooth actually grew and erupted through and came in underneath that. Now that doesn't, Dr. Spradley told me, I talked to him here just today, that this doesn't happen uh, really but about half the time when you bring a tooth like that. You take a tooth from here and go down and plant it, and digging a hole is very hard. Most of the time he does this, he'll take a tooth out up here and extract the tooth, say down here, and then he can put that tooth in this area. Sometimes you'll have to wire it and keep it in position, stabilize it and everything, and keeps them out of occlusion at first, and then let them come up in occlusion once they get growing. But that's about half the time. But you can transplant one tooth. I guess you could take one over here and move it over to another spot if you wanted to. We're doing some marvelous things in dentistry now. Instead of worrying with that, we just put an implant in and put a crown on it and go on with that nowadays. Anyway, that's was an interesting tidbit in orthodontics and dentistry that you can transplant these teeth around. So I appreciate you watching this, and I hope you got something from it to add to your orthodontic knowledge, and also the old surgeons and deal with the old surgeons and getting a lot of things done. So this is several years after we finished this young lady. It was 1986. It's 7 years from the time we saw that last Panorex X-ray. So I'll say adios, and I'm going to kind of withdraw here from this if I can find out where my deal went to. Okay.